Welcome, everybody. Thank you so much for joining us. My name is Meg Davis, and I'm with the Global Health Center at the Graduate Institute, and you're joining the Global Health Center's Coronavirus Global Perspectives series. We're interested in governance, politics, and power in global health. And with countries racing to bring the virus under control, human rights increasingly seem to be under attack. So today we're being joined by panelists who can speak to these issues. Emily Christie, who's a senior human rights advisor from the Joint UN Program on HIV and AIDS, UNAIDS. Rajat Khosla, who's a human rights advisor at the World Health Organization. Alan Maleche, who's executive director of KALIN in Kenya, and also a delegate on the board of the Global Fund to fight AIDS, tuberculosis, and malaria. And Shen Tingting, who's a human rights expert based in Beijing, China. I'm going to moderate the discussion, but before we start, I just wanted to frame what we're going to be talking about a little bit today and give a bit of an overview to human rights and global health. So human rights, for those who are new to this conversation, are a body of international human rights laws, international laws that countries sign and ratify and then are bound to uphold through their own national laws and through their practices, their good governance. And human rights principles include fundamental principles of transparency and accountability, non-discrimination, equality for all. Most countries have ratified most of these standards, so they are widely accepted. And one of the key human rights standards we're going to be talking about today is the right to the highest attainable standard of physical and mental health, which is not a right to be healthy, because we're all born with different DNA. We all make different choices in life that affect our health. But it's a right to health goods and services that are of a high quality. Of course, some countries have limited resources, but they're still responsible for making progress, deliberate steps towards fulfilling the right to health for everyone. And regardless of resources, all countries have to ensure some basic principles are upheld, such as equal access to health services for all without discrimination. As we've seen in the past, other human rights issues can also affect your right to health. So your right to clean water, your right to shelter, your right to freedom of expression, and your rights as a person before the law, all these have an effect on your right to health as well. And we'll be talking more about that today. We're seeing this play out already in the COVID-19 crisis, which is rapidly escalating. We're seeing the result of chronically poor investments in fulfilling the right to health in many countries. We're seeing the impact of lockdowns enforced by the police and the military. We're seeing lack of social protection programs, lack of food security, lack of clean water for many. And especially these lacks and these absences and these abuses are felt by groups who have historically been victims of discrimination. Minority groups such as the Roma, other ethnic minorities, racial minorities, migrants, refugees, sexual and orientation, homeless people, prisoners, a huge burden being felt by women and girls, especially as they're a large proportion of healthcare workers. And perhaps most worryingly sometimes, threats to whistleblowers who point out where the epidemic is on the rise. In some countries, we're seeing a rapid expansion of state surveillance. And there's a debate going on in many of our homes, in many of our communities, about whether we just need to accept that some human rights get set aside during a time of crisis like this one. Or alternatively, maybe human rights can help to offer us a way out of this global mess. So the experts we have with us today are going to help us see through these problems and see some, hopefully, light on the horizon. And human rights is not just a body of laws, it's a global movement of many people, including some of the ones on this call today, activists, experts, civil society groups, communities, scholars, and officials who work together and support one another to make global progress. So we're going to start with a discussion among us on the call, the panelists. I'll discuss with them. And then half past the hour, we're going to open up to address some of your questions. So if you scroll down to the bottom of your screen in the Q&A, you can see a box where you can type in your questions. We're eager to hear them. Some people have shared them in advance, and we'll come to those at half past the hour. But to begin with, I'm going to turn to Emily Christie. All of these folks are not just experts, they're also good friends. So I'm happy to see them on the call. Emily, UNAIDS was one of the first UN agencies to put out guidance about human rights in COVID-19. And this was interesting because it's UNAIDS, not UN COVID. So tell us a little bit about why you felt that was necessary.
Sure. Thanks very much, Meg, and thank you for putting on this webinar. I think it's incredibly important to talk about these issues right now. In 40 years of the HIV epidemic, we acquired significant experience and knowledge, often hard-won, as to the importance of human rights approach when responding to an epidemic. And we wanted to make sure that those responding to COVID-19, which includes UNAIDS and other stakeholders, community groups, governments, other UN organizations, we wanted to make sure that those responding to and affected by COVID were able to use those lessons and experiences that we have from the epidemic. There's a lot of similarities between the two. There's things like new criminal laws coming in. We're seeing police raids, travel restrictions, stigma and discrimination, the cracking down on criminalized groups, such as sex workers or people from the LGBTI community. There's a failure to involve communities. And all of these are reminiscent of the early days of HIV and indeed continue in some countries today. As we know, this has a huge effect on the response. To give an example, we know from HIV that people who have experienced stigma and discrimination in healthcare are 2.4 times more likely to avoid healthcare than others. We know that communities have to be part of decision-making if the response is going to take into account the particular needs of communities, of what is considered to be essential for communities in the time of COVID. And so we released our guidance to try and make sure that this was in front of everyone and that we weren't going to be making the same mistakes again and again. We released it in mid-March, and even then we could see that some of the same human rights concerns were being raised as in HIV. What's particularly worrying is this reversion to the use of criminal law. Criminalization of exposure or transmission of COVID is something that we're seeing a lot. We're seeing criminalization of people who are breaching lockdowns and restrictions. And we see these playing out in a way that targets the vulnerable, targets minorities and those who are already stigmatized. So we're seeing the targeting of sex workers and the raids on their homes, targeting of homeless people, migrants, and people who use drugs. And we know from the world of HIV that this criminalization doesn't have the effect that we think it does. It increases stigma, it increases discrimination, it makes people go underground, less likely to be able to access healthcare or to look after their own health. So what we talk about in HIV is this idea of removing human rights barriers and creating an enabling legal environment. So instead of using the law and responses to say, don't do X, we use the law to say, to provide ways that people are able to do the right thing, that the barriers that stop them from being able to say physical distance or self-isolate are taken away. So you could say in COVID, so helping people to protect themselves and others, allowing people to stay at home. Police officers beating a person who has a drug use dependency isn't going to help somebody suffering withdrawals to stay at home, but the bulk dispensing of needles and community delivered opioid substitution therapy is. Raids on the home of sex workers won't help them practice physical distancing if they have a family to support, but ensuring they're part of social protection mechanisms so that they don't have to work during this time will. And all of this is, of course, predicated on the need for communities to be at the center. And that has been one of the key learnings of the HIV response. Communities need to be able to propose and play out the solutions that work for them. They need to be able to tell governments what are their essential needs so that things like condoms aren't taken off the market during COVID, as we've seen in some places, so that people are able to access the markets, that people with a disability are able to have access to their carers. We know that there's this idea that public health and human rights are somehow in tension or opposition, but what has been found is actually the only way we will reach our public health goals is by following human rights principles. And so we've tried to really put that out in the guidance with clear information and recommendations on how countries should be implementing their response.
Thank you. Thank you for diving in with that guidance, which has been a great resource. And I think many of us who worked on HIV in the past, I really have a feeling of here we go, deja vu all over again, seeing a lot of the same issues playing out. I wanted to turn to Ting Ting in Beijing because, of course, China was the first country affected by this outbreak. And Ting Ting, it would be really helpful to the degree that you can share with us what lessons you think we can learn from China's experience in regards to human rights, both good practices and things that you think other countries should not repeat.
Thanks, Meg. I think two of the key things that China has done right is that after the initial denial, the government takes speedy actions to respond to the outbreak and made testing and treatment free for people who needed them. But there are, of course, many human rights issues in China's response. I focus on two issues today. The first one is suppression of information and censorship. Basically, China repeated the same mistake they make in handling the HIV and SARS epidemic, trying to cover the news and punish people who tell the truth. The 8 doctors in Wuhan who tried to warn people about the virus were quickly silenced by local authorities. The government even ran a nationwide propaganda campaign on television channels, alleging the 8 doctors were spreading rumors. This censorship directly led to the spread of the virus and undermined the public and the healthcare workers' ability to protect themselves. The death of Li Wenliang, he's the early whistleblowers who died from the virus, is really a wake-up call for many people in China. It triggered a huge wave of demand for freedom of speech, because people started to realize that access to information actually is a life and death issue. But the government continued to censor information about the outbreak and harass activists who spoke out. According to Chinese human rights defenders, more than 452 people have been punished for spreading rumors. Because the government didn't take the early warnings seriously, the virus spread quickly that the government had to make a hasty decision to lock down the city. But the whole society and the social system were not prepared at all, and people have no time to buy food, medicine, or other essentials. There is a serious human rights crisis in Wuhan, especially in the early days of the lockdown. Public transportation was suspended. People had to walk hours to the hospitals. Even the highway was shut down. A truck driver was stuck in the highway for more than 20 days because he can't go back to Wuhan, and other cities refused to let his truck in because his license was from Wuhan. This is a common practice taken by many Chinese cities to avoid any possible transmissions. Similar situation happened to people who stuck in Wuhan city for different reasons. Most of them were migrant workers. When the cities was locked down, they have no place to go and become homeless. Those people rely on volunteers to provide them with food because all the restaurants and supermarkets were closed. Only until February 15th, a month after the Wuhan lockdown, that the government announced that it would provide social assistance to people from another province but stuck in Wuhan. But I think the most tragic thing are those people who needed a bed at the hospital. On Chinese Twitter, Weibo, there was a designated place for people with coronavirus to post their situation and ask for help. It flooded with desperate messages. At the meantime, the coronavirus have taken up all the medical resources for another illness. Local hospitals suspended regular service and were mandated to only receive patients with COVID-19. So people with other illness have no place to get urgent and life-saving treatment. The government strategy basically is to sacrifice a city to save the whole country. As Chinese people, we are quite used to the idea that as individuals, we can sacrifice our rights to support the goal of the community and the society. Even though we need to consider the rights of people who are not infected but at the risk of infection, is that justifying the death of the people in Wuhan? Is there a better way to deal with the Wuhan lockdown? Do we have to let those people die in pain while the hospitals in other parts of China are empty? These are just a few questions and heavy lesson learned from China's handling of the crisis. Thanks.
Thank you so much, Ting Ting. Really powerful to hear about some of the challenges China faced in figuring out how to respond to this. Alan, I expect you're feeling a little bit of deja vu as you hear Ting Ting's description. Can you tell us a little bit We've all known that the virus was coming for Africa soon, and now you're starting to see cases increase in Kenya. What kinds of things are you seeing from a human rights perspective? Thanks.
Thank you, Meg, and I'll just build up to what Emily and Ting have adequately said. I think what we're seeing in the Kenyan context is a situation where we are turning more to the use of criminal law and criminal sanctions to enforce public health measures, contrary to many guidances that have been given in the past by various bodies, including UNAIDS, including the Global Fund, including ICJ, including many other bodies. And that is proving to be a challenge where you then are seeing more of human rights violations in the way mandatory quarantine is being done, in the way isolation is being done, people not being provided with information, and government putting more punitive measures on people, for instance, put on a mask, maintain social distance, whereas in certain situations, like in informal settlements, the issue of social distance is a pipe dream when there is not enough spacing in the areas, or you're telling people to wear masks and you've not made provisions for those masks, and people cannot be able to afford the masks. So that then proves to be a challenge. And we've seen also with the lockdowns and curfews, excessive use of force by the police officers to quell and attack people who are trying to get home in time to avoid the curfew. And that in itself as a measure shows the danger and the risk the police themselves are putting themselves at when they go shooting tear gas canisters, being violent to people, they're exposing themselves in the particular process. And also we've seen a rush of laws and regulations being developed by the Ministry of Health with very limited time for public participation. And particularly we now have regulations that now define people who either have COVID or suspected to have COVID as carriers. And that if someone reasonably suspects they have COVID, they should be reported and they should be held in isolation or in mandatory quarantine. I think secondly, we're seeing a big challenge on the health system, particularly with fair labor rights and working conditions for healthcare workers. There are donors who have given money to buy protective equipment for healthcare workers, but we are yet to be able to see any of the effects of those protective equipment making to healthcare workers. And this has caused a lot of tension between the government and many union bodies about whether the government is actually protecting healthcare workers or not, who are particularly on the front line of this particular response. And that again is extremely crucial. I want to end with the third thing, although there are many other things, but the third critical thing has been access to healthcare services and the right to information. We have seen women not being able to have access to contraceptives or their regular clinics. We've seen difficulties in children going on with their vaccinations. We've seen difficulties with people living with HIV or those with TB having to go to their regular clinics because some have been converted into quarantine centers, some have been converted into isolation centers, and for some of the healthcare workers have already been adopted to go towards the COVID response. So that then poses a challenge for those who still need lifelong saving medicines, and that then again is a challenge we are facing. And then the challenge around the fact that when the government is not very transparent with its information, it leads to a lot of speculation. And particularly for the case of Kenya, people are concerned that we've seen the World Bank, we've seen the Danish government and many others give funds to the government, but we've not seen reciprocation from the government in terms of making it transparent in terms of what that money is being used for. So I think in summary, those are the three challenges: use of criminal sanctions and to enforce public health measures, the challenge and burden it's putting on the healthcare system, particularly on healthcare workers, and actually exposing the fact that we are not doing enough to protect healthcare workers who should be on the front line to help us fight this particular disease. And also the challenge around transparency, accountability, the right to information, and the disruption of health services, despite the fact that many guidance from many other organizations, which I'll talk about later, including the Global Fund, including ICJ, including UNAIDS, that's talking about, and even organizations such as HIV Justice Worldwide that talk about the importance of not having to use criminal sanctions. But I'll come back to that later on. Meg, those are just some of the highlights. Thank you.
Thank you. It sounds like it's going to be a very busy time for human rights activists in Kenya. So thank you for sharing that overview. Rajat, we're going to turn to you because Alan has raised an issue that I think has much broader implications. And we've seen in many countries that there are not enough resources, in particular masks, ventilators, and more. And how should countries prioritize when they're facing this kind of a crisis and they don't have enough to address all of the different urgent health needs?
Thank you, Mag, and thank you also for the opportunity to participate in this discussion. And indeed, one of the key challenges that is facing every country, irrespective of their income levels today, is shortages of supplies and equipment, from testing kits to ICU equipment to the basic PPE equipment, which are in short supplies all around the world. And I must say at the start that one of the things that this crisis has exposed is the extent weaknesses of health systems to respond to humanitarian emergencies such as this. And there are two key learnings which are becoming amply clear. One is the historical underinvestments in health systems, which has resulted in the lack of resilience capacity within the system and the preparedness that was required to be ready to respond to shocks such as those presented by COVID-19. And then the second is in terms of stark inequalities, both between but also within the countries in terms of access to some of these services, goods, and equipment. A big question, therefore, that is confronted from countries around the world is how do you therefore distribute these rather scarce resources into the hands of those who need it the most? And these are extremely difficult questions, even in normal time, exacerbated because of COVID-19, and have huge ethical and human rights implications. This not only undermines the infection prevention and control measures which are being undertaken by countries, but it also has a likelihood in terms of putting the lives of the frontline health workers at grave risk of themselves having infections and having resultant mortality and morbidity that ensue therefrom. But I must say, those working within the humanitarian sector are well aware of some of these challenges. We do have the tools and equipment that we must draw upon right now as we look at these difficult decisions. A couple of things that I would want to highlight in terms of what needs to be done. First and foremost, all governments around the world are required to make urgent measures to ensure the provision of PPE equipment and safeguard the rights of frontline healthcare workers. Without them, we really cannot fight the COVID-19 fight in any effective way or measure. The second is the question in terms of what do we do when we do not have adequate amount of supplies, equipment, ICU kits, ventilators, and so on. Human rights and ethics require a few safeguards that must be put in place as individual healthcare workers, governments, policymakers are confronted with these extremely difficult choices to be made. First and foremost is the principle of non-discrimination and equality. All decisions must be guided by the principle of non-discrimination. My colleague from UNAIDS gave certain example in terms of certain challenges facing certain key population group, but this applies across the board. We have individuals who are homeless, those living in detention facilities, those who are migrants or refugees who are at huge vulnerabilities in terms of their inability to access services, and therefore must be guaranteed services at the same levels as others. The second is the issue in terms of the provision of clear communication and participation of patients, their families, and larger communities in the decision-making processes that are undertaken on how some of these resources are being distributed and what measures are being placed within the system. And then finally, what I must emphasize is the need for oversight and accountability for all measures that are being taken place. A colleague from Kenya just talked about sweeping measures that are being taken, and these are very familiar all across the world today, from voluntary isolations to derogation of rights to other measures that are being taken. And what these requires, as unprecedented these situations are, which are requiring such curtailing of civil liberty. What it does require is the institution of oversight and accountability mechanisms so that there are checks and balances as individual governments make these decisions, so that we are protecting individuals against human rights violations that might result as a consequence. And one must not forget, healthcare systems, the healthcare workers today are human rights defenders. These systems are becoming human rights systems over and above everything else, and the responsibility, therefore, is very profound. I'll stop there now, but happy to come back to some of the details as we go along.
Thanks, Rajat. Great comments. And you know, as you talk about these issues of discrimination, I'm reminded from previous discussions with colleagues at the Global Network of People Living with HIV, such as Rico Gustav. They've called for putting the last mile first. So prioritizing the people who have been historically the victims of discrimination, who've historically had trouble accessing health services, that if your health system is really meeting the needs of those populations first, it's going to work for everyone. And I wonder if we can think about that in the context of the COVID response as well. As we're talking about transparency and accountability, I just wanted to flag one issue that's close to my heart, or that's, you know, my current preoccupation, which is about the expansion of surveillance in the name of health surveillance and in the name of getting us all out of lockdown and enabling us to, quote unquote, restart our societies again through using contact tracing, using our mobile phones and other kinds of digital tools, artificial intelligence, to track individuals who have been exposed to the virus and to encourage them to go into quarantine or compel them to go into isolation. And I just wanted to see if anyone wanted to speak to that. I know in China, this has been widely used. There's been some discussion about it in other countries. And I don't know if any of the panelists want to speak to this issue of expanding surveillance and the debates around that.
I can say a few words. The outbreak in China definitely has allowed the government to expand its surveillance system in the last few months. And since late January this year, when people go to a public space, they need to either register online or scan a QR code or write down like their contact information. For some time, I live in a small city in the south of China right now, and for some time during the lockdown, people even need to leave their name and ID number when they want to buy medicines for cold or fever in a pharmacy. Also, the use of a health code app has been rolled out in more than 200 cities in the country. With the app, it will determine the health conditions of a person and decide whether this person needs to be in quarantine or can go out to a public space. People are quite concerning because it is not clear about what data the app is collecting and how the system works to classify people. The app basically can monitor and trace people's movement and has helped the government to strengthen its social control system. However, I think that the Chinese people are not likely to fight against it because our legal framework is really weak in terms of protecting privacy and personal data. And since the government having already built a massive surveillance system, it is already really normal to many people, and we just accept it.
Thanks, Ting Ting. And I think it's been really interesting to hear from you and from other colleagues in China about the very live debate that exists among legal scholars in China over the limits of surveillance and over the need for due process in managing this. So it's great to see that there's this kind of discussion that we can all learn from in other countries. I want to turn to the questions now because we're getting inundated with fantastic questions, most of which we will not get to in the remaining half hour. But I want to at least start with one that came in advance, since they were kind enough to send us a question in advance, which is from the Geneva Global Health Hub. And they shared with us on Twitter the case of a journalist who had reported apparently about COVID-19 related deaths in Rwanda, which he said made the leaders look bad. And then subsequently, this journalist got harassed on Twitter by trolls denouncing him. And the question was, is this a human rights violation? Anyone want to speak to this one?
Hi, Meg, I'll give it a go. Noting that Rwanda is a bit closer to us, but that doesn't mean that's what's happening in Kenya. But I think the challenge that is posed right now is the fact that governments need to find a way to constantly keep their citizens updated with honest, transparent, and accurate information, such that they are able then to control what they've been calling fake news or alarmist news. But the difficulty we're seeing is that sometimes governments are slow to provide this information and people turn to other sources. In all situations, we have advocated that media freedom should be exercised. Media freedom should not be curtailed during these times of lockdown or COVID, but also for the media to exercise some responsibility in terms of how they report. So other than harassing journalists or those who speak publicly about the health situation, I think for me, my view is that governments should strive to give more information and to be more transparent so that citizens can be less worried about whether this is fake news or not fake news, but also for them to quickly react and respond in an honest and transparent manner when such issues are raised, to either distinguish them or to make it clear why it's not the truth and why we may not want to listen to that particular effect. Thanks.
Thanks, Alan. Yeah, I think we see with this outbreak the really fragile nature of trust between citizens and the states, right? And how difficult it is to maintain trust in the context of this kind of an outbreak where governments are struggling to figure out how to respond, and people are trying to figure out how they feel about how the government's responding. If we lose that trust, then we lose our ability to respond, and certainly to get people to take a vaccine once the vaccine comes out. So that's also a little bit scary. We're getting a lot of questions about lockdown, and I think we could have a whole separate 1 hour at least discussion about the rights of states to lock people down, the rights of people to not be locked down. So where's the limits? I mean, do states just have sweeping abilities to lock people down? Or, does anyone want to speak to that? Where's the limits?
Thanks, Meg. Happy to have a go at that. And this is one of the big challenges that we are confronted within the COVID-19 context, is in terms of lockdowns, quarantines, and other emergency measures that have been instituted by countries in terms of containing the spread of the pandemic. And one needs to be reminded in this regard of certain guidance that we have in terms of the International Covenant on Civil and Political Rights, the Committee on Economic, Social, and Cultural Rights, General Comment 14, but also the Syracuse Principles in terms of the extent and the limits of derogation and how they might apply in relation to public health emergencies such as this. And there are certain...
You got to explain what derogation is. Not everybody knows what that is.
Whereby certain countries might be able to limit certain human rights given the nature and threat posed in extreme circumstances. And I'll explain it a little bit more in terms of some of the guarantees that are being put in place, which are human rights and legal guarantees, but also informed by issues related to ethics as it's around on these measures. The first and foremost is that any such measures must be taken place in accordance with the law. These measures cannot be undertaken just on the notion of a whim or a threat, but they have to be legal measures. They must be based on a legitimate objective that needs to be pursued. And in this case, as we know, the legitimate objective is with regards to the spread of the pandemic and trying to contain that. Any such measures must be measures that are strictly necessary. They should not be excessive measures as such. And all this that I'm saying is nothing new. It is all within the existing legal human rights documents. Furthermore, not only these measures should be strictly necessary, these measures must be undertaken as a last measure. Countries must explore all other measures that could be undertaken in this regard, and institute such lockdowns, quarantines as extreme measures as they might be. And finally, they must not be arbitrary. They must be instituted with clear checks and balances and information to the population in terms of the limits of these measures, the duration of these measures, and what kind of oversight and checks and balances that are instituted. And these are important things to be reminded as we look into not only the existing measures, but also further measures that might be required as the pandemic continues in different countries in different measures of severity. Thank you.
Thanks, Rajat. Does anyone else want to come in on this? Because I have to say, like in the US, where I'm from, I am hearing a lot about people who are still, driving around, going to supermarkets, having parties. And when people challenge them about this, they say, well, it's my human right. So is there any limit on this? Alan, I can see you're dying to get in there.
So I think the question we've raised and a number of civil society in Kenya have raised about the issue of lockdown is that, and the advisory we gave to the government and a number of UN agencies was to say that if you employ a lockdown methodology, you need to figure out how are those in informal employment going to have access to food, to water, to health, and other social amenities. And while they're on lockdown, how well are you carrying out more testing so that you can be able to know who has the virus, who needs to be treated, and who needs to be isolated for purposes of treatment. However, just having a lockdown for the sake of keeping people at home or limiting people's movement is not sufficient enough in terms of a public health approach. So I think a lockdown must go along with certain obligations on the government to make sure that if I'm in a slum area or an informal settlement, I have running water, I have access to food. If I fall sick, I can still go to the hospital and get attended to, and that during the period of the lockdown, they're actually being able to attend to me. Now, in terms of the issue of, and I've seen many questions on the chat box, which are quite useful around, how do you go about enforcing a lockdown without criminal laws, without criminal sanctions, and what has been the experience with TB or HIV? And I think if you have a look at publications by HIV Justice World, if you look at publications by UNAIDS, or even the upcoming guidance by the Global Fund on Human Rights, you will see that the approach needs you to invest more in giving people information rather than promoting the criminal sanctions. Now, the difficulty here is more of, we will arrest, we will jail, rather than telling you why a lockdown is important and how the lockdown is contributing towards reducing the spread of the virus. The message we get is that the police will arrest you if you're not going to go for lockdown in time, if you're not going to be able to put your mask on. So I think the balance that needs to be struck here, Meg, is that even though there may be restrictions on your movement, your freedom of association, there needs to be an explanation as to why, and for you to also see what are the benefits of that particular lockdown, because I'll be happy to stay in the house knowing that the government will come and test me, and if I could not afford food or water because I have to go out together, then they'll be able to provide for it. I'll pause there so that we can get time to answer more questions. Thank you.
Thanks, that's great. Emily Ting-Ting, do you want to speak to this one, or should we move on?
So I think I had plenty to say, but Rajat and Alan have already said all of it much more eloquently than I could. So,
okay, thanks. Ting-Ting?
And we can move on.
Okay, well, in that case, I'm getting a lot of questions, or I'm seeing a lot of questions coming to us about international cooperation and what are the obligations on wealthy states in terms of helping other states, and how should we see cooperation move forward? It's one of the questions we got by email was about whether the leaders of the world could unite to create a universal basic income to enable people who don't have sufficient employment to survive this crisis. And it sounds like a lovely idea, but as I was saying earlier to the panelists, we can't even get them to unite to share masks. So whether we can get them to unite to share universal basic income, is a nice goal. I don't know if we're ready for that yet, but I just wanted to see if any of the panelists wanted to address this question of international cooperation, especially, seeing what we've seen already about what worked and didn't work in the response to HIV, tuberculosis, malaria, and other epidemics.
Thank you, Meg. I'm happy to have a go at it, and just to emphasize a couple of points. And as you rightly said, in terms of the need for global cooperation, which has been repeatedly emphasized by the Secretary General of the UN and also the Director General of the World Health Organization, we've already seen in the last several weeks now, in terms of the damaging effect that COVID-19 is having on the economies of the high-income countries. And it is likely to have a devastating impact on the low and middle income countries. And it is starting to become obvious as the pandemic is reaching to some of these countries. And it's also very clear that low and middle income countries will require international assistance and cooperation to effectively respond to the variety of effects that the COVID-19 is going to have, not only on the economy, but most importantly on the populations themselves, both of whom who are in formal and informal economies. And this is where human rights has got a very important role to play. And I think we need to remind ourselves both of the UN Charter, but also of the numerous international human rights treaties and conventions. And importantly, the point that human rights obligations transcend borders. International human rights obligations that state parties undertake are not confined to the domestic territories. They are also obligations beyond borders, and particularly in relation to international assistance and cooperation. What is also important, if you read some of the guidance that has come out from the Committee on Economic, Social and Cultural Rights, but also through other work within the context of SDG 16 and elsewhere, that these obligations are not subsidiary or sequential to the national obligations. They are at par to domestic obligations. And let's be clear, unless assistance, both financial and technical, is provided to low and middle income countries to respond effectively to the COVID-19, we will not win this fight. And therefore, the obligation that we have as a global community is imperative in terms of making sure that technical assistance and know-how, financial assistance, goods and equipments are available. And as somebody said very rightly previously, as and when the vaccine is available as well, that these goods are equally available to all, everywhere. So I think that would be my takeaway on this issue. Thank you.
Thanks a lot. I'm sure that we're going to need to see a lot more international funding and aid. What is the best use of that from a human rights perspective? And now I'm looking at Alan because he's been on the board of the Global Fund trying to wrestle with these questions with other epidemics.
Sorry, Meg, would you say that again?
What's the best use of funding? How do you ensure that the funding actually reaches the people who need it most when you're dealing with an outbreak like this?
So I think to ensure funding reaches the people who need it most UN agencies, most donors have already had mechanisms in place where they have known how to work with communities and reach people on the ground. I think they must find a way of fine-tuning those mechanisms to continue working with communities, people affected by this particular COVID epidemic, and ensuring that proper support is given to them. I know many of the donors or the agencies' first point of entry may be to support government agencies because that's what seems to be the right thing to do. But I think there's a very important role that needs to be played by many of the donors who finance very important work on human rights, on access to life-saving treatment, on access to maternal health issues. They need to find a way to continue working with those who they have been funding and helping to take things forward at the community level, because if you don't engage the community in this COVID response where they have the right information, they're supporting the government in terms of positive public health messaging, they will not be able to win the fight. And so as much as donors may want to channel money to government agencies, they need to find ways and mechanisms which already exist to try and get support and funding to those at the grassroots level and also those facing the front line of the battle.
Thanks very much. Anyone else want to speak to this one before we turn to another question? Going once, going twice.
Hi, Emily here. Just to say that when it comes to international funding, we need to make sure that, well, ideally, the funding would not be diverted from other incredibly necessary international funding that is already going to vulnerable communities and to very necessary services, that we would be getting international assistance and funding that is in addition to what is already there. Otherwise, we will lose things like contraceptives, we will lose things like money for rights advocacy or for harm reduction. The other one is to recognize now what the implication of weak health systems is. And so looking at where this funding is going and why we need it now should also be informing long-term funding and how we can make sure that countries are resilient when another pandemic comes through. And it's the same with immediate and long term. This international funding shouldn't just be at the immediate health level. Yes, we absolutely need to make sure there's funding for ventilators, that there's testing, that there is treatment once we have better treatment and vaccines, but also that it is going towards things like social protection mechanisms, that it is going towards if countries decide to implement some type of UBI, so that those broader socioeconomic human rights impacts that we're seeing are also addressed. Because in the long term, if we are looking at long-term lockdowns, long-term economic distress as well, and the effect on vulnerable communities, that could have a much bigger impact on certain communities than the COVID epidemic itself.
Thanks, Emily. You know, I'm always struck when we have these conversations, you know, human rights people were always thought of as being these like crazy activists. But once you get us sitting down, all we want to do is expand the government and have them get bigger and do more and take on more of a role. And we want them to do everything. And I think, isn't there always really a kind of a challenge? And especially at the moment when so many economies are in crisis, governments, we're going to need governments to do more, but they may actually have less in terms of resources. Just to play devil's advocate for a moment.
COVID tax on businesses, perhaps? That's not a UNAIDS party line, that's just a...
That's an Emily party line. One of the questions we've gotten has been about prisons and you know, what governments should do in regard to people in locations where social distancing is really a challenge. So prisons, in slums, in closed settings, what is it that we want to see happen in those kinds of situations? And we're seeing now a growing number of protests in prisons from prisoners who are worried because they're not getting enough information, they're not getting access to care. Emily, are you eager to jump in on this? Go ahead.
Specifically on the prisons one, just because we've been doing a fair bit of work on this with a number of other organizations. There is a big push, and we support it, to try and reduce the number of prisons at the moment, because it is difficult for them to physically isolate and distance, because not all the prisons necessarily have the access to services that they need. So the very first recommendation that we are starting to see in a number of countries, and I know Indonesia released a lot of prisoners recently, is for prisoners who are there for non-violent crimes, who don't present a danger to society, and particularly prisoners who are there for crimes that are not recognized under international law, should be released. And if there is an assessment for others who can be released because they've done, for example, 75% of their time or anything like that, that should be taken into account too. For those who are left, one of the key issues, if you are starting to isolate prisons, is to make sure there is access to testing and services, of course, and other health services, but that they still have access to the outside world and to legal support. And this should be done through Skype or telephone calls or something that will require additional resources from government. But if you are trying to look to keep the mental health and physical health of your prisoners, to maintain their right to legal counsel, and also to try and prevent rioting and unrest, that contact with the outside world is absolutely crucial. So they're the key recommendations that are coming from UN organizations, and there are also requests from civil society as well, to make sure that things like harm reduction are still in place, that there are protections against violence, that your ARVs are still being provided, and things like that.
Thanks, Emily. That's great. And I think this is really showing for many of us all of the fractures and the problems we had in our own societies, right? I think we're seeing the inequalities in the wealthiest countries are just being made worse by this outbreak, and even more so in countries that have limited resources to begin with. And so I'm just wondering how we're going to come out of this. What kind of situation are we going to be in regards to human rights when all this is done? Anyone want to gaze into the crystal ball and predict the future?
So I'll give that an attempt, Meg. I think just before I give that attempt, I think I'll quickly say, in addition to what Emily said, I think again, it points back to the issue of criminal sanctions and the fact that when you have criminal sanctions in place, you end finding out people being arrested, say for not putting on a mask. You end up going to jail, you're all crowded there, the courts have scaled down the operations. your access to justice is limited, and then you increase the risk of either passing the infection to another person. So again, that aspect of access to justice is extremely important, and courts must find ways to reasonably operate in terms of being able to ensure that those who are arrested for whatever crimes that have been done try to get access to justice as quickly as possible. I think on your question, it's one or the other way. You'll have the countries that will embrace a rights-based approach and probably use the funding and the resources they get to take a holistic way of looking at the right to health, trying to ensure that when you do human rights intervention in the context of the right to health, you're looking at other socioeconomic rights, and you're looking at how rights are interdependent. So you'll probably find countries that will learn about the importance of human rights, put them into practice, and be better prepared for pandemics, and probably in the process strengthen their health systems with the funding that they're able to create internally or that they get externally. Then you have the other extreme where you will find countries going into more criminal sanctions, punitive measures, and more dictatorial measures, including surveilling people as a way of trying to limit human rights in a way of trying to control pandemics. So that's what I foresee, and I hope that it's more that countries will see this is an opportunity to strengthen health systems, it's an opportunity to prepare better for future pandemics, it's an opportunity to invest more in people, in human rights, in socioeconomic rights, and to begin using our local resources and funds in a more transparent way that would ensure a better future for all citizens in the world. Thanks.
Thank you, Alan. It sounds like we're really at a crossroads here. Rajat, did you want to come in on this one as well? Do you have a prediction for the future?
Thanks, Meg. Not exactly with a prediction for the future, but very much to chime in and agree with what Alan just said. And a couple of things to add further. I think one of the key takeaways from this crisis, and as we look into the horizon of what life post-COVID is going to be, is that as bleak as the situation is and continues to be for a lot of people around the world, as much as it is an opportunity to build back societies for better. And one of the key ways to build back the societies for better is by grounding them in human rights and human rights protections. He said very eloquently already in terms of needs for investments in health systems, need for protection of socioeconomic rights, need for ensuring privacy, confidentiality, rule of law, and governance guarantees are embedded in these visions of our future, which might be. Because one thing if COVID has shown us, as global as the challenge might be, as interconnected as the solutions are going to be. We cannot abandon human rights as we look into the future. We have to embrace it, but we also have to embed it now in everything, from socioeconomic measures to rule of law situations to aspects related to how we reconstruct the health systems in multiple ways. And this is where I think there is a lot of opportunity, but also a point of reflection to look back at the three visionary documents that came out in 1948, the UN Charter, the Constitution of WHO, the UDHR, all of it came from the scourge of the Second World War and created a charter for humanity, for the future, for dignity and well-being for all. And I think we are at a very similar moment as we look into the future, although we didn't have the horrors of the war, but we did have a pandemic that challenged all the foundations everywhere. So I think building it back for better is where we should start from.
Thank you, Rajat, for that vision of the future. And I just want to, as we start to move towards wrapping up, and I'm sorry we didn't get to all of the amazing questions in the Q&A, but we're going to take note of them and think about how we can come back to them again. I just wanted to, since we have 2 civil society and 2 UN people on the call, give you a chance to say what you would like to ask for from each other. I mean, what does civil society need from UN partners? What does the UN need from civil society? Alan, I'm going to pick on you first.
Emily, after this we'll still be friends, but let me just tell you what civil society needs from the UN. And I think it's not just only the UN, I think it's both the UN and multilateral development institutions. I think the first thing we need is for the UN and multilateral development institution to provide the much needed technical and financial support to both governments and communities around the COVID-19 contingency plans. I think it's time for WHO to start speaking up more about rights-based approaches and not only medical interventions. I think this is a great opportunity for the UN family to quickly get together in country and figure out how do they reprogram some of their existing grants to be able to fit the needs of communities and civil society to be able to respond to this. How do the UN agencies play a critical role in helping governments to be transparent and rights-based in the manner they approach various interventions within the country? I think for me, the UN and multi-development partners have a big role to play. We have bodies like the Global Fund of Gavi who are funding important work. I think we need to find a way to ensure, and I believe the Global Fund is already doing this, to ensure that funding for the key programs, be it vaccination, be it HIV, TB, and malaria, does not stop going on. They facilitate their grant-making processes to go on, because some of their funding is crucial because it gets to people down at the community for them to be able to develop rights-based approaches. And I think for me, most importantly, the IMF, the World Bank, has a role to play in terms of looking at loan readjustments, especially for the poor countries, and other barriers that may have been put in place in terms of trade that need to be looked into. I think I would conclude by saying that it would be very critical for the guidance notes to continue to be developed. I know UNAIDS has led the way. The Global Fund, our delegation, has worked closely with the Community and Rights Gender Department to try and ensure that we have a guidance coming out. The guidance should be in languages that can reach all citizens, including those with disability. And I think such information should be continued to be done. And I believe the UN family, multilateral development institutions must not forget civil society and communities in the approaches and interventions they take forward. So I think that would be my quick reflection for now.
Alan always comes with an ask list. That's one of his great qualities. Emily, do you want to come back with any requests that you have for civil society?
So many. No, Alan, I didn't get all of that written down, so you'll have to tell me again later. So what we have seen from civil society already has been incredibly useful for us to be able to respond, which is a very organized response by civil society groups, providing lists of demands, highlighting human rights abuses, and in some cases highlighting some best practices that we're seeing in places. I think at this point in the game, we do actually need more of the good practices. I've looked at the list of questions in there of how can we do X, how can we have lockdowns without criminal sanctions, how can we make sure that people self-isolate, how do we make sure people don't starve. We know some of this, but being able to learn from other people's practices and what they're doing and what civil society is seeing working is going to be incredibly useful as we go forward. Yes, we can provide guidance, we can keep shaking our finger when things go wrong, but it's a lot easier if we can tell people what's going right and get other people to do that. We're of course trying to collect information through our own networks, but hearing it from civil society rather than from somebody high up in a UN institution does tend to mean more to me because I'm hearing it from the people who are experiencing it. So that would be great.
Thanks very much, Emily. And I see we're just about out of time, and I'm so sorry because this is such a rich conversation. But I think we've seen that it's critical that we start to think about how to use human rights to get ourselves out of this disaster that we're in. Human rights violations are part of what got us here, right? So it's restrictions on freedom of expression by Dr. Li Wenliang in Wuhan that got us into this mess in the first place. But then in addition, lack of investment in global health systems in countries like the US and the UK, which are now fueling the epidemic in Africa. So we see that we're all connected, that we have to have fundamental human rights in order to find a way forward. And so we're going to need our human rights movement to be continuing to stay strong. I'm sure COVID is going to be part of all of your job descriptions for the next few years, whatever your job descriptions were 2 months ago. I want to thank very much Alan Maleche from Kalen in Kenya, Shen Tingting from Beijing, Rajat Khosla from the World Health Organization, Emily Christie from UNAIDS. Thank you so much for sharing these reflections, and especially at a time when we know that you are extraordinarily busy. The conversation is going to continue. So next week, we'll have another session of this webinar on April 21st, What's Law Got to Do with COVID-19, moderated by Suri Moon, co-director of the Global Health Center. And I encourage everyone to sign up for our mailing list if you want to continue to get these updates. Thank you for joining, everybody. Please stay safe, stay well, stay fierce, Keep fighting for your human rights. Keep fighting the good fight. And we'll see you again next time. Thanks and bye-bye.